Hello, I'm Dr. Mark Besancon with Hillcrest Animal Hospital, and this is your pet tip of the month. Today we're going to be talking about heartworm disease. Heartworm disease is very common in South Texas, and for that reason, many people need to become aware of, if they are not aware of it, to protect their pets from heartworm disease. What is heartworm disease? Heartworm disease is actually a worm that is called Dirofilaria immitis that is transmitted by the mosquito. For the whole life cycle process, it takes 6 months for a dog to become infected. What happens with that is a mosquito goes and takes a blood meal or some blood from an infected dog who has adult heartworms and is producing babies or microfilaria. The mosquito picks up some of these microfilaria from the blood. The microfilaria molt a couple stages and become infective at that point. They go and they land on another dog that is not infected, and they place those infective larvae into the muscle and the tissues of that dog, and those infective larvae or immature worms will migrate to the heart and into the vessels in the lungs, and where they grow to become adults. And those adults then begin forming or have babies, microfilaria, which basically presents the whole cycle all over again, and then they are now an infected dog that could potentially infect other dogs if a mosquito were to come and take a blood meal from them. Heartworm disease is very, very serious. These guys can develop several complications to heartworm disease. Right-sided heart failure is one of the big ones. These worms cause a lot of damage in the heart and in the lungs, and that is the reason that these guys need to be treated if they are positive for heartworms. Mosquitoes in South Texas, they're everywhere, and the need to keep these guys on prevention, which we'll talk about a little later, is key to keeping your pets from getting heartworm disease. What are the clinical signs? What are you going to see at home whenever your dog is infected with heartworms? Basically, it can vary. Some dogs may never show signs. If they have a low burden or low number of worms in the heart and or lungs, then they may not show many clinical signs. They may be normal, happy dogs. Other signs that you may see, some of these guys will become listless. They don't want to move around much. During exercise, they'll tire easier. They'll form a lot of these guys will form a cough that will become more persistent as the disease progresses and there's more damage to the heart and to the lungs. The cough will become more severe and become a little more noticeable if it's less frequent. Weight loss. Many dogs that are losing a lot of weight and don't really know why, definitely check a heartworm test if they're not on prevention to make sure that that's not the reason. As they get into the further progressive part of the disease and heart failure starts to come about, there are some other things that can occur. Their belly may get big, they call that ascites, and other things where they might develop fluid in the lungs and stuff like that. If any of these signs occur, definitely take your pet to your veterinarian where they can do an exam and differentiate the problem that could be going on. Diagnosis, how do we diagnose heartworm disease? There's a simple blood test that can be run that detects the actual antigen or worm that's in there. It's a snap test, can be run in the clinic, and you will get results within about 10 to 15 minutes if your dog has heartworms or not. Another test is where you drop a drop of blood on the slide and see the little babies that these adult heartworms produce that the mosquitoes actually ingest that become infective to other dogs. Treatment. There are several treatment protocols. Treatment of heartworm disease is definitely risky, but is done routinely by veterinarians. You are actually killing the adult heartworms that are in the heart and lungs, and so obviously there's going to be fragments of worms floating around, and so keeping these guys confined, not letting them get very active, is very key to treatment of these guys so we don't have any secondary complications during the treatment. Treatment usually involves some injections in their back muscles. The injections are pretty painful and definitely need to keep your dog confined so that more pain is not, does not happen with these guys. Your veterinarian will go over everything with you, set up a protocol based on your pet's age, the severity of clinical signs, and what's going to work best to get rid of those adult heartworms in your pet. Prevention is probably the most important part of heartworm disease because it is so easily preventable. The prevention, for the most part, there are several kinds out there, several brands. Most of them are chews or pills that you give once a month. There are some topicals that you can put on their back and they'll absorb into the skin. And then there is an injection that can be given that lasts several months. Few veterinarians may have that could offer that for you. The most common is the pills and the topicals. These things do not only help prevent heartworm disease, but they also will kill intestinal worms. If there's any intestinal worms, it will help with that. And the topicals will actually help with flea prevention and other things like that. Several products out there, your veterinarian can work with you on that to get you the best one that fits your pet the best and your ability to give the meds. In saying that, prevention does not kill the adult heartworms. If your pet has been diagnosed with heartworm disease and has adult heartworms, the prevention will not kill the adults. That is why it is so important that you get your pets, especially young dogs, if they're less than 6 months old, they need to be on prevention by 6 months old. If not, they need to be taken to your local veterinarian where they can be tested, and if they're negative, then can be placed on prevention, and that is given once a month. This keeps it actually protects from the microfilaria and any immature worms, keeps them from becoming adults. Once they're adults, other treatment has to be performed at your veterinarian clinic. So basically, these guys need to stay on prevention. Every dog, especially mosquito season, in South Texas, I would recommend keeping them on it year-round. There's mosquitoes all the time. We see infected dogs all the time. Indoor dogs, outdoor dogs, both. Mosquitoes can get in the house, so if your pet is just strictly an indoor dog, they need to be on prevention as well. So to prevent this potentially deadly disease, there is an easy prevention with topical and oral medicine, and I sure recommend that you get your pet tested if he hasn't been on prevention, and then get him on prevention to help prevent this disease and potential side effects and even death in your pet. Thank you.